And what Jack Feldman began to study and notice is that sighs are actually naturally built into our breathing system, and they're regulated by the brainstem, and that they're necessary for like a little reset for the vagus nerve and for the brain and body to work together for optimal health. Then he started to introduce that we can actively engage in cyclic sighing in order to replicate the benefits that happen when we do it unconsciously. And if for those of us that have experienced trauma or patterns of holding our breath or restricting the breath or shallow breathing, we might lose that impulse to follow the cyclic sigh urge. So now we can use the cyclic sigh to recover this natural inborn quality. And the cyclic sigh, it typically has a two-part inhale and then a single exhale. And it will look something like this. You can try on your own if you'd like, 2 or 3. You don't need many of them to feel their impact. And take a pause and see what you are noticing. A little spark, a shift in any of those autonomic feedbacks around how your eyes are tracking space, how you feel in your body, how your mind feels. You can always try it again and experiment and notice. And what's interesting about them, and there's a whole lot, again, I talk a whole lot about this in the new book, but there's a lot of research about the role of breathing practices that temporarily engage your sympathetic system, which if any of you felt a little bit of sympathetic engagement in the cyclic sighing, that's part of it. And that the purpose of the re-engagement of the sympathetic is that then it will actually reset your body's urge for homeostasis and you'll come back to parasympathetic. So we find, and if if you practice yoga and you do something like a Kapalabhati or a breath of fire or more rapid kind of breathing, and you do it temporarily, the research is showing is that the benefit is that we get a temporary removal of the vagal brake, the temporarily sympathetic activation with active recovery back to parasympathetic. So we are training the vagal brake with these kinds of breaths. Yeah. You doing okay? Yeah, all right. I get some thumbs up, 2 thumbs up. Cool, cool. Great. They're replacing the roof on the house next door. If you are hearing like random loud noises in my background, that's what I hear. But Zoom usually does a pretty good job blocking it out. So you're not hearing it. Cool. Okay. You sometimes hear it like a drum beat. No, we're okay. I was trying to read your hands, Bambi, and I was like, what does that one mean? Cool. All right, back into our slides. So there's cyclic sighing. And the diving reflex, this is a lot of our cold water exposure, and many of us have been exposed to that in some form or another, especially with Wim Hof out in the world. And you don't have to dive into a total cold ice bath. You can splash cold water on your face or hold a bag of ice cubes against your face or your neck. And sometimes it will also naturally facilitate that rapid inhale. Or you can also do a brief hold of your breath as you're throwing the cold water on your face. It's a practice I do every single morning. I absolutely love it. I sometimes will add a little bit of a brief cold exposure when taking a shower, those kinds of things. It's very easy to incorporate this into your day. And you're going to get, again, a brief sympathetic impact followed by a parasympathetic input. So you're going to reset in a similar way. The Valsalva maneuver is an attempt to exhale against a closed airway. And you do this by keeping your mouth closed. You can even pinch your nose if you want. And then you're attempting to breathe out. It's going to increase pressure in your chest cavity. Again, a temporary increase of sympathetic followed by a parasympathetic recovery. So if we do that one together, we won't do the cold water exposure here unless you want to run and get your ice cubes, but the Valsalva is an inhale, and then don't exhale, but a try to. And then let it go. Let the breath be natural following that, and see what you notice. Anyone notice anything? Yeah. We'll check in. We'll check in after we complete these. I want to hear all of your experiences. Yeah, you'll feel some stuff, right? And the key when I'm offering multiple vagal toning practices at once is like to really listen to yourself. And when you're like, oh, that was enough input for me, then just pause. That was enough for today. And you can come back to the recording and do other ones when you want more. Okay. Back into our slides. We'll do just a few more and then we'll open it up. So there's a little bit of the research here on the sound and how listening and your vagus nerve are so deeply interconnected. The vagus nerve works to tighten or relax the muscles of the inner and middle ear, and it will tighten a muscle called the stapedius muscle in the inner ear, which reduces sensitivity to low vibration sounds, and it allows a baby to hear the mother's voice, helping to increase anyone's sensitivity to the human voice. And when we engage or give a little bit more tone to the stapedius or the tensor tympani, it helps to regulate the middle ear bones, and it will again diminish some low frequency background sounds. So in the yogic system, we have the honeybee breath or a humming breath, which involves covering your ears to amplify the sound of the humming. And you can just hum yourself a song. You can sing in the shower, right? Some of you are already going there. Right? You can do the voo that Peter Levine offers in somatic experiencing. All of these are serving those same purposes of stimulating the inner ear, middle ear, but also when we do the voo or the humming, we get a resonance in the chest. Maybe we can even resonate through the belly through that sound. So we'll do a brief voo together. Sometimes again, because of Zoom, it will block out my sound. So just follow your own sound, and with or without covering your ears. You can do a voo or a hum and resonate that vibration into your body and play around with it for a moment. And when you are complete, take a moment to notice, receive it, feel it. Good. Beautiful. All right, just a little more. So we played with this lightly when we did our first practice and kind of catching where the vagus nerve comes close to the surface of your face. And then there's also specific areas that Stanley Rosenberg speaks about in his book, The Healing Power of the Vagus Nerve, which I think I have in my downstairs office, not this office, or not my yoga space, but we're finding these areas where the vagus nerve comes close to the surface, and these also happen to correspond with acupuncture points and meridian lines within the Chinese medicine system or the nadis in the yogic system, and beneficial for your vital organs. These meridians, again, can be thought of those channels or rivers of energy that are connecting to heart and lungs and liver and kidney and stomach. And it stimulates the energy flow. So you can do so by tapping. And for those of you that are familiar with tapping or attended the recent tapping summit and did my tapping practice there, you are waking up through the vagus nerve. I've been in really lovely communication with an Australian-based researcher who is looking at how the EFT tapping, and if you're not familiar with those tapping points, they're here in the inner eyebrow and to the outside of the eye and below the eye, above the lip. Below, I'm just doing them quickly, below the chin, below the lower lip, collarbone points and ribcage points. And this research is looking at basically how doing EFT tapping is also tapping into the healing power of the vagus nerve. And we can also work with key points, and we often do this intuitively by rather than tapping on those points, creating a little bit of just self-massage. If you've ever had a headache, don't you just go here, right? We just self-massage through those tension headaches and under the eye, across the top of the cheekbone. You can do this with me. You can pause, find circular movements, and I'm moving through relatively quickly for our purposes, but I have an upcoming vagal toning class you can join me on that I'll do again in April, and you can come do just a long practice without the lecture with me there. And then you can find different points here below the cheekbones as well. And it's so intuitive. And once you find a tender spot, pause, give it a little massage. You're getting into the fascia of the face. You're opening up all of these communications. And then here at the ear points, that you can go to the tragus. This is where the clips go on for the external or transcutaneous vagus nerve stimulation, but you can self-massage that cartilage in front of the ears or around the concha of the ear, sometimes referred to concha or concha, but it's basically the seashell of the ear, and your fingertips can massage just around where the ear canal is, considered to be 100% vagal fibers in there. So we get into a lot of ways to self-massage and open up this channel. So our final few slides here, and we'll open it up. These are some of those facial acupressure points and what we just played with, and you can spend longer time exploring them. The tragus and the concha or the concha. And our last one here is the self-havening, and many of you have done this with me before. It's a beautiful psychosensory intervention, and we can amplify that by really bringing in things like coming back to your glimmer and your glow and that which you're grateful for, feeling that throughout your body, and then adding the self-havening touch. So that we get that psychological component and the sensory intervention. And the touch has been shown to reduce heart rate and blood pressure, and it lowers norepinephrine and cortisol. It increases oxytocin and positive emotions and GABA and serotonin. And that the touch points, specifically researched by Kate Truitt, she's the researching director for the Havening Institute, are the palms of your hands. They have C-tactile fibers, particularly receptive to touch. Your face from center of forehead outward toward your temples, along your hairline, your cheeks, and shoulders down to elbows. So before we come back to our final slides, just doing that together for a moment. And typically in this particular movement, we move slowly. So rather than that rapid hand movement, this is a nice slow, really feeling that connection to each of your palms. And then if you'd like, bringing your hands to your face, moving across your forehead and outward. And from bridge of your nose out towards your temples, across your cheeks. breathing, sighing all the way through. Let it feel good. If you want to do that hairline one, it's like, just let it feel good. You can even go across your whole scalp. And then shoulders to elbows. Delish. You can pull back to mind your glimmer, your glow, anything that you feel grateful for at this moment. I feel grateful for doing this practice with all of you. Feels pretty darn good. So that chance to connect. Anna, it's nice to see your young one with you there. Hello. You can do it too. Beautiful. Hi. All righty. And you can keep doing the havening. I'm just going to share the last few slides here, and then we'll take some time together. So this one that I want to share is that if you scan this QR code, then we have set up a 20% off and free shipping through Norton. So if you haven't ordered the new book and you want to order it through them, you can scan the QR code, or you can simply go to my website under my blog and you'll find that same link to directly pre-order the book. So that's exciting for me. It's comes out officially on March 19th, so it's still new. And these are all the resources and ways to stay in touch. I have a lot of these practices up on YouTube, and if you're not subscribed to my newsletter, come join me there. Although I think a lot of us are connected. So that's what I have for you. And Liv, I'll help you open it up for us into some time to connect.
Awesome. I will set it up so if you'd like to upvote a question, if anybody sees a question in the Q&A that you'd like to hear answered, you can upvote it now and stuff, and then that'll help us pick which questions we want answered. And then, did you want to take some questions live?
Yes.
Okay. If anybody has a question, feel free to raise your digital hand.
Great.
You can find that at the bottom of the screen under reactions.
Yeah.
Um,
And they can be questions and they can also be responses to the practices. So,
cool.
do share how the practices landed for you, what arose.
Awesome. Okay. Looks like Sheila is ready. You can unmute Sheila.
Hi, it's actually Sheila Merle.
Hi, Sheila Merle.
The part that most interested me didn't get a lot of attention, which is the sound practices. You
Mhm.
went over them very quickly, and I would really like to learn more about how that affects the nerve, what kind of sound practices. And the other one that I was very confused about was this.
Yes. Yes.
But the
So
sound is what most interests me.
you got it. You got it. So the majority of the research out there about the sound practices it can be found through the Unite website and Steve Porges's Safe and Sound protocol. They have a whole lot out there about the research behind the sound. Some things that I'll kind of offer up around it is that when we are feeling safe, the middle ear muscles have more tone to them. There's more tone to the stapedius and the tensor tympani. And that toning of those middle ear muscles sets the nervous system and the ear up to be attuned to the sound of another person's voice, specifically the range of the maternal voice. Because of post-birth bonding and nursing and being able to cue that orienting response towards safety. And so the soothing sounds and the vocal prosody, or that kind of sing-song quality, like if you ever, see a cute small animal and you're like, oh my gosh, you're so cute, right? We kind of go into this a little bit of a higher tone and more of that prosody. What happens when we experience trauma or stress is that our ears are tuning to potential sources of danger out there. And those potential sources might be a growl, right? I don't know if my mic picked that up, but like a low growl of a tiger, let's say. And so our ears are going to pick up the cues of danger, or they're going to be hypervigilant to sounds that might be cueing threat out there. And so when we think about, for example, children that have been growing up in an unsafe environment, and then they get to school and they have a hard time paying attention to the voice of the teacher, because they're hearing the heater, they're hearing the shuffling of the clothes, they're hearing the all these other background sounds, and they have lost this ability to prioritize. Not from here, but at the nervous system level, the nervous system is prioritizing cues of threat. So over the prioritizing of the sound of the teacher's voice for learning. I need to know what I need to get away from. And so things like the safe and sound protocol work to retune the ears to cues of safety, and then the nervous system follows suit. And when we work with humming, for example, and the ears, the classic position is with it doesn't really matter, with the hands down. You can place your thumbs in your ears to close it off, and you're humming or you're singing to yourself, or om, right? Whatever sound you want to make, it just amplifies that sense, that sound. And then Peter Levine brings in the breath, this low, resonant sound. And what I have found with my own practice is that sometimes it's a low hum or a low thing because that resonates in the belly. But sometimes you actually want to work with higher tones and see where it resonates, or what song feels like it's opening up that connectivity. All right. Thank you. All right, Liv, I'll let you take us where we need to go here, sweet.
It looks like Zara. Sorry, I didn't realize I was muted, so I was like, all right.
Ooh,
Hi.
ooh, hang on, we got feedback going.
Oh, what's going on?
Sorry, Zara. It sounds like there's like a strong echo. If you want, I'll message you in the chat and try and help you figure that out. But in the meantime, we'll take a question from someone else if that's okay.
Yeah. Usually it's because there's two devices, like a phone and a computer. So if one of those gets turned off, it helps.
Yeah, fair enough. All right, Amanda, if you'd like to ask.
Hi there. So Arielle, my question is related to using vagal toning in sessions with clients. I often use a mix of modalities, and I sometimes struggle to just find the when, because it feels like it doesn't always take up like an entire 50-minute session.
Mm-hmm.
So do you feel that it's best to engage with a vagal toning exercise right out of the gate to sort of set the tone for the session, or to wrap up with a vagal toning exercise to help regulate? Any
All
input would
of
be
the
great.
above. I mean, in some ways, like, you answered your question, and I'm loving it because you're on track with it. And we don't want to use a whole session just for vagal toning, because we would miss their reason for coming, right? They would feel kind of like over regulated in a sense, or over controlled by us. But if when they come in the room, we say, would you like to do a little bit of an arriving practice together? And maybe you do 3 minutes of self-havening, right? And then we say, all right, now that you've checked in, or maybe we do 3 minutes of conscious breathing together. I had a therapist I worked with many years ago who started every session with this breath. Just 3 of them, to awaken more breath and more body awareness right out of the gate. So and then a chance to check in of what you'd like out of today. So depending on whether someone is in more of a low tone coming into the room, or a high tone, you might do more of a calming practice. That one that I just did is pretty energizing. But so you can see what would be a good match. If they're feeling a little overwhelmed at some point in the session, we can come back and say, would you like to do just a little bit of a practice that might help you drop back into the regulation zone, or into your window of tolerance, or whatever words we're using. I have a particular video I show when I do the mentorship program here. So if you've ever done that program, you've watched it with me. But basically it was a woman who's very highly dissociative. And as we're working together, each time she starts to get nauseous or dizzy or start to feel dissociated or go away, we just bring in 1 minute, 2 minutes of a gentle practice. It may be hands holding the head, maybe a little bit of a rocking, maybe a self-havening until she's back in the room, and then we can go back into the working.
Okay, great.
Yeah.
Thank you so much.
You're so welcome. And like you said, it's a great way to bring it in at the end, right? Before you send them out the door. And if you, for those of you that don't have the flip chart, this one is built for in-session integration of these things. So on the front of a page, for example, if I go to a random page here, it will have a breathing and a practice that you can invite them to do. They can see the picture. On the back of it, you as the therapist have a script to guide them through that practice. And so there's, I think, 20 practices or so in here that can be this. The whole purpose is just how do you bring it right into psychotherapy? And
Oh,
so
great.
there's, yeah. So this is the flip chart, and you can find all of these on Amazon or wherever you like to buy your books.
Perfect.
Yeah, thank you.
Thank you.
Liv, you are muted again, Liv.
Sorry, I keep doing that. Sorry. So we have a quick question in the Q&A. Someone was asking, you mentioned some research on the majority of information goes from the body to the brain. So would you mind naming the original research that has identified the majority of information, 80% goes from the body to the brain? This fact is repeated so often in various literature and lectures, and this person's looking for a reference where it's been.
Great question. And I almost wonder if I'm referencing others who are referencing it. And it's such an important question. And I would have to spend a little bit more time on it to get back to you to tell you. I'm like looking in here, I'm like, do I have the original of the original? I'll go back and look for it. I'll see if I can get it to you. We'll see. But I find that it's really helpful to get those original cited. I was just actually doing an interview on some of the research that shows that the corpus callosum doesn't fully develop until the age of 12. And again, that same question come up of like, well, who's the original of the original? So we'll look for those things together and see where that originally came from. I think I originally heard it from Steve, but I can ask him as well.
Awesome.
Steve Porges. Yeah.
Well, thank you. All right. And then Sarah, I think, is ready to take a question or ask a question now. Hopefully this sounds a little better now.
Yeah. Can you hear me?
Yes.
Okay. Sorry for that. Yeah, that was my device, other device. Well, I want to thank you first of all, and I enjoyed during San Diego. So it was amazing. It was such a joy. And I want to share that without all this information, it's so interesting. I've been teaching yoga for so many years, and my background is I was a medical doctor from Armenia, so maybe that was somehow bringing that knowledge. But I mean, I've always taught like more intuitive classes, and it was always, through the sound. And I always invited, and I'm so happy now that there is so much resource that I can really, because some people would come and they were like, and, I was inviting everyone very gently, yet, for some people, still, they're fearful to make a sound. It's very interesting to observe. And right now I'm going through very difficult time. My daughter is in rehab and was overdosed and on fentanyl. And this is one of the things that I bring so much to the community, yet to my own daughter, I don't even know like how many ways I tried. Before it was lovely, but after the drug use, I don't know how to approach, even like a tiny bit of information. Oh, it just brings her. She had a lot of trauma. And what would be your because like anytime I even start talking about the breath or start talking or not even talking but doing it myself, it triggers her.
Wow.
Everything and anything.
Yeah.
like she doesn't let me to even touch her, like anything,
Yes.
anyone.
Yes, yes, yes. First of all, I just want to say thank you for sharing your story and your question, and it's very vulnerable, and it's really important. And I don't know if you heard during the conference, but there was another parent there that asked a very parallel question to yours about their own child and addictions, um, to Gabor Mate, and his response was really touching. But I would going back to, I think, very much for me, one of the signals around that, the push that you're describing with your daughter, that her urge to not let you get close, is that the first regulating response to that is actually to honor the push and say, how far away do you need me to be for you to feel safe?
Yeah.
And that there is something that hasn't been heard in that around her trauma response, restoring a boundary. And so we start with that, and then perhaps from there, there's a way in. But until we can attend to whatever the rupture is, and even, I think that there's almost always attachment rupture in there, not as a way to blame ourselves as parents, but just to attend to the truth of what is, and whatever other generational trauma. I mean, we can broaden that lens as to why those ruptures are there. But we have to attend to the impact of that rupture with compassion, and not with over guilt and not with shaming yourself, but with compassion to say, I didn't know what I didn't know at the time. And you're right. And that injured. And we make amends as we can from as far away as we need to be, and to see if that opens a door.
Yeah.
Yeah.
My dear one, thank you so much. I just want to ask you one more question,
I'm
because,
aware that we have a lot of hands up, and so
yeah, I'll
unfortunately
do
I
it
can't
in
take
the
the
chat.
two.
Okay,
Thank
thank
you.
you.
Thank you.
Thank you.
Yes.
All right. And it
Thank
looks like
you.
we have a question from BMB. If you'd like to unmute.
Hi, Bambi. I was like, what is this? Wait, what is this?
I don't know if you saw the answer. I see your blind jump
Oh,
every once in a while.
I didn't see the answer. Oh, that is funny. Yeah.
Yeah, anyway.
Yes.
So in you doing this exercise, thank you very much. I've never seen anyone else do it, and it just came to my mind one day, because I noticed that a lot of people have very, very tight, almost stringy, not so much back here, but right along the
Yes.
vocal cords, and
Yes.
possibly even back there.
Mhm.
Yes. And so my question was, is that definitely a sign of stress? Now, then you also brought in tinnitus and hearing pertaining to not being able to hear low tones, which can be the like you say, the lion, the growling, and so has she turned off? I'm thinking about a friend of mine. She has to wear hearing aids because she's an educational psychologist working with all the children in this different
Yes.
field of neurodiversity. So is she getting pulled in? Is it tightening her up? And
It's a question that goes a little bit beyond my scope in terms of like what else might be contributing to hearing loss. But but I do know from the sensory processing material that there are ways in which we will dial down the hearing of things when if we feel bombarded by the stress of it. It's kind of almost like dissociating from those cues in the environment. So sometimes we're very dialed up and hypersensitive to cues of threat, and sometimes our nervous system will dial them down on our behalf. And so we actually, like when my daughter was born, she had a lot of sensory integration challenges, and her speech was profoundly delayed. And we worked with an OT and a speech therapist and so on and so forth. But the piece that they described to me is that she wasn't hearing the language to learn how to speak because her nervous system was protecting her highly sensitive auditory system. So it dialed down the sounds, and then she struggled creating them. In terms of your question about this, I would also be really curious where all of this tension is is creating tension around the hyoid bone right here, and that that we work so gently in here in all of the tension that goes between the palate into the ear, into the throat, into these front muscles. And fascia release, we want to work with so lovingly, so gentle, self-massage, sound, as we've all been talking about, is so important. So beautiful. Thank
I've
you.
also mentioned to people to include in that, then pull their jaw up
Exactly.
and forward.
That's exactly right.
Help open this up a bit. Thank you.
Yes.
Yes.
Yes. That's how I taught it in San Diego, and I didn't add that piece here, but it is a beautiful piece when you're pulling down and then jutting the jaw forward. Yeah, exactly. Thank you. All right,
Awesome.
I will take one last question and then we need to close out.
All right. Well, it looks like we have Donna. You can unmute if you'd like.
Hi, Ariel. Thank you.
Hello.
I was also in San Diego, and I really appreciate all your energy. I'm so impressed that you're able to hold a coherent class today. I could barely hold a sentence. But my question is, I am pretty new to the polyvagal theories, and I am obviously very interested in it, and I'm not sure where to begin my study. I really want to study and have evidence-based, data to show my my colleagues and my people who come to me, but so I don't know where to start my study. If you could kind of guide that.
Yeah, there's a whole variety of ways that I could recommend starting. One is that I have a course that I'm teaching through PESI that I teach again in May, and it's a 2-day, 12-hour course that is about applied polyvagal theory and embodiment and trauma treatment. Deb has her programs out there. Deb has amazing books out there. And so I think that Deb Dana, sorry if I didn't say her last name, Deb Dana would be a great place to start, and just kind of sorting through. And the hard thing sometimes is which book to start with. I
Right.
personally really like her Polyvagal Exercises for Safety book. I think that's a beautiful one. And it's going to be exercise heavy, but it does give some of the science behind it. Certainly you can get a lot of the science of it in this one.
Okay.
This is my new one. And then the Polyvagal Institute has ample resources as well. So you can go spend time on their website and sign up for some of their webinars and learn it. Steve is hard. Deb is a good translator for Steve. I'm a good translator for Steve. And sometimes you go directly to Steve and you get all of the science and you're just like, oh my gosh, what in the world did he just say? So if you're new, I would start with Deb or myself.
Thank you very much.
Yeah. Thank you. All righty.
Awesome. All right. Thank you so much, Ariel, for such a great class.